let me start with this. Number one, you don't need an MRI to know exactly what's going on. Like, you just don't. It might seem really easy. It might seem like, oh, all I got to do, I know there's something on the inside that's causing my pain, that's causing my back, that's causing my hip to hurt, that's causing all these problems I'm having. There's got to be something to blame. I mean, like if you have like a tumor or a fracture, those are important things to know. But if you're concerned that you have a disc, degeneration, arthritis, a labral tear, pain is very complex. I've learned this over the course of 20 years, but also research shows that pain is more complex than we give it credit for. You know, it's not as simple as taking a pill. Just understand that if it's okay with you to think a little differently, especially if you've been struggling for weeks, months, or years, maybe it is time to think differently about what's going on with your body, because there is no magic pill or magic surgery or magic picture of your body that's going to tell you exactly what's going on and is going to fix this forever. Yes, sometimes surgery is absolutely appropriate. Most of the time, when you hurt, you tweak something, you've had pain for a long time, you're recovering from an injury, you don't need an image to know what's going on. We see the sports players will get hurt and they'll get sent directly to the MRI. You're like, it's almost at the stadium. Like, oh, did they really tear something? But I can tell you this, my hands can tell if you've torn something or not. My hands, in critical reasoning, by watching you sit, stand, walk, and tell me what's going on, I'll know exactly what's going on. Because I have experience and I have time. What most people don't have right now is time, so medical providers, it may not even be their fault, are just so slammed with time. They're like, go get an image, and the image will tell us. Now, we've got this image, picture, MRI, X-ray. MRI is magnetic resonance imaging. We've got this, now we got something to blame, so let's throw modalities at it, injections, medications. Oh, let's go fix it with surgery. I can tell you this, surgery isn't gonna fix why you hurt. It might fix something on the inside that seems not normal, but it doesn't always fix the pain. That's why people are coming to us 6 months, 6 years, or even a decade after their surgery and they still have pain. That's why surgery for back pain is no better than a sugar pill. You don't need that. The problem is when you get an MRI, you're more likely to get surgery or injections and you'll spend $5,000 more. That's a research statistic. When you see a PT first, your cost of getting this problem resolved is a lot lower, and your potential side effects are almost nil, right? They're almost none. Like, you might feel sore, you might be a little irritated, your body might hurt a little bit more, or it might feel a whole lot better. Whereas with medications, you can have a bleeding ulcer, even with like Tylenol or Advil. You can have a hospital-borne infection. Right now, you go in and get surgery, injection, you could get COVID, you know, and you could die from surgery, or you can lose feeling. I mean, those are all negative side effects. So we're not going to talk about that. I want to talk about all the positive things. So your body is strong and capable. Your spine is resilient. It's supposed to move. Your knees are supposed to move. Arthritis is not the end of the world. So you might have been told, like, you're bone on bone, or you've got the worst arthritis I've ever seen, or you should never do blank again, lift 35 pounds again, because it might damage something. Or you've got a pinched nerve. A pinched nerve, when someone says a pinched nerve, what's really happening is there are no pincers actually pinching it. It just looks on the image like it's being compressed, and you might have pain. And we've seen hundreds of patients who are being diagnosed with one of these like pinched nerves, but the pain isn't congruent with where that would be if I looked on the image. So let me get back to the MRI. The MRI is supposed to show you everything. And when you get the results, the radiologist, who doesn't have to have seen you in person, is just going through this picture and going through hundreds of pictures a day and just listing all the things that are off normal from the textbook. But what's really happening is the majority of these findings on the MRI are normal age-related changes, just like wrinkles. There are wrinkles on the inside. You see, I got wrinkles, I'm 46. I've got wrinkles on my skin. I'm sure I have wrinkles on the inside. The worst problem is right now, the way medicine is set up is as a patient, you're getting the results of your tests, and not just MRIs, but of like your blood level tests because you had thyroid cancer 5 years ago. You're getting those tests delivered to you via like MyChart or the internet before your provider even has a chance to sit down with you to help you interpret it. And you see all these really scary terms. You go to Google, you get freaked out, you talk to your friends, they're like, oh yeah, the herniated disc runs in the family. You know, pain is, you know, the worst thing I've ever done. I could never exercise again. Now we're not exercising, we're not strong, we're, as a society, we're gaining weight and obese, and now we're more susceptible to other diseases and infections and viruses like coronavirus. I mean, if we're not healthy, and how can we be healthy if I can't work out and walk and go to the gym and it hurts to get off the couch? It's like this downward spiral. The results on the MRI do not tell the whole picture. People come in, or people have gone into through studies to get MRIs without any pain or symptoms, and they'll still have a full list of findings on the MRI. So I want you to understand that you are not your MRI results. And if you really want to know what's going on, you need to speak with someone who is an expert in pain, injuries, and recovery, as well as can look at your whole body. And what that's called is a total body diagnostic. A total body diagnostic is where we take a look at your whole body and how it moves, because where your body's telling you you hurt may not be where the problem is. You can have shoulder pain, but it's because your mid-back doesn't move well. Or you might have hip pain, but it's because your ankle's not moving well. And if you go in and you say, hey, doctor, my hip hurts, and they go, ooh, that's bursitis, let's do an injection, and then it doesn't work, and let's do an MRI, oh, you've got a torn labrum, oh, let's do some surgery to fix your labrum, and you've never been to PT, or you've never been to multiple PTs, you're going down the wrong path. But it's not your fault, because that's the path that is the path of least resistance for the way the medical system is being incentivized right now. So what you need to do is you need to stop and think, well, gosh, am I scared about my testing results? Okay, I need to speak to someone who has time to sit down with me, hear my story, and explain what's happening, and even possibly offer me an alternate understanding of what's going on. Because if you've been struggling for years because of a herniated discs heal. I mean, they do heal. They heal just like a scab. So, and if you're still thinking, well, I've got a herniated disc, I can't do X, Y, and Z, then you need to be seeing someone else. And the way we do it here is we'll take all of our patients through a total body diagnostic exam. It's 20 minutes of your time where we sit and chat with you about what's going on, what are your goals, where the problem is, how long it's been there. We look through your whole body. We find out where you hurt. We replicate the symptoms. Okay, I can replicate your symptoms. Now I know we can help you. And then we know exactly where the problem is, and you'll know exactly what you can do to fix it without going and spending weeks waiting for an MRI, getting the results and getting freaked out, going into the hospital right now where, you know, like other people are who are sick, and you might get, whether it's COVID or just a hospital-borne infection. And why get that unnecessarily when we know what's going on and we can start helping you resolve the problem right away instead of waiting 2 weeks to get your results, and then 2 weeks to see if treatment works and maybe see if it goes away on its own, which if it goes away on its own, it doesn't mean the problem's gone. That just means your pain has changed.